we got that news that I was going to have open heart surgery. And I remember uttering those words like, me? I'm a nurse. We take care of those patients together. I certainly couldn't be a patient.
As a mother, you always think, what could I have done differently? And as a nurse for 43, almost 44 years, it's amazing to me that I didn't pick it up until that day when we were sitting outside and you said, I'm having one of those episodes. And it was the most frightening thing in my whole entire life, watching you almost pass out and telling me to take the baby.
We need to realize that these patients are going through something that most people can't fathom. However, now you and I can fathom that. We've gone through it. We've dealt with the stress. We've dealt with the numerous doctor's appointments. We've dealt with the anxiety and the sleepless nights. And then, of course, post-operatively, my biggest anxiety was waking up intubated. I see my patients. I feel bad for them that they have to wake up with a tube down their throat.
I had to laugh because you were air writing. Take this tube out. And I said, Lindsey, I can't do anything about it.
What went through my mind was, I get what our patients go through. You're the family member. And now we come into nursing with a whole new vision, a whole new motivation, a whole new outlook on how to treat those patients. And if you want a patient to do well, it really is about examining and learning and looking at the whole patient. That includes pain control, emotional support, and then supporting the family.
I totally agree. And one of my mantras has always been, since I've been a nurse, is I did not wake up today to have a massive heart attack or a massive stroke and invite myself to be in an ICU with tubes and machines and everything around me. Nobody wants to be there. So we have to hear me and see me.
Having a nurse like that is absolutely necessary to healing and to recovering.
For me, this has been a journey that's been heartbreaking. It's been strengthening. I know it's given us a much stronger bond. We've gone through this now hand in hand and soul to soul. I'm so inspired by your strength, your tenacity, and by how courageous you were.
Thank you. I pride myself in taking care of these patients and their families, but I'll go back to work in a month as a completely different nurse. These patients will walk out of that hospital like, we got excellent care.